Okay, so today we're going to talk about the complex extraction procedure, which you'll need your local anesthetic, the basic setup, and then for the basics you'll need your mouth mirror, the explorer, the cotton pliers. The mouth mirror is for indirect vision, to retract the lips, the cheeks, and for direct light that goes into the mouth. And then for the explorer, it's to examine for decay, calculus, and any abnormalities that the doctor may see. And then cotton pliers is to grab or transfer items in and out of the oral cavity. And then you'll need your scalpel, which is for tissue or trim the tissues. And then you'll need your periosteal elevator, which is to separate the tissues from the bone and to hold the tissue away from the surgical area. And then you'll need your straight elevator, which is to loosen the tooth or separate, lift from the socket. And then you'll need your east and west elevator to loosen. Your east and west elevator is to loosen from the root or separate it. And then you'll need your forceps, which it could be any kind of forceps. It's doctor's choice, which is to like extract the tooth. Then you'll need your root tip pick, which is to remove and lift small roots. And then you'll need your rouge, which is to trim and remove excess bone. And then you'll need your surgical curette, which is to remove debris from the surgical site. The bone file is to remove, to smooth, and to like smooth the rough edges. And then you'll need your high-speed handpiece with the surgical burr. And then you'll need your sutures, which your sutures is to for the surgical site, like to suture the surgical site. And then your surgical scissors is for like cutting the edges. And then you'll need your needle holder hemostat, which is to grasp and manipulate the surgical needle. So right here, I'm going to show you a picture of every instrument that I just talked about. So this is the picture. This is the setup that you'll need. And then once you have like the whole setup, you would need to make sure that you open all of the instruments in front of the patient, because you don't want to open them not in front of the patient, and then the patient will think that they're not clean or they haven't been sterilized and all that. So you got to make sure that you open it in front of the patient. And then you got to make sure that you get the patient's medical history. You got to seat the patient, get the patient's medical history, and make sure that there's nothing changed in their medical history or anything like that. Or if they're taking medication, that if they're not taking new medications or anything like that. And then you got to get their vital signs and everything. And then and then after that, you explain the procedure to the patient. Make sure that they know what the procedure is that they're gonna be having. Um, and then and then after that, the doctor's gonna come in, and then you just start helping the doctor like transfer um, you would have to then you could start helping the doctor transfer the instruments, which instrument he's gonna need, and things like that. um, and then and then you um, and then you have to have like it's like a sterile gauze sponge, which is to for like the bleeding and stuff. And then and then you make sure that you give them like after everything, you make sure that you give them their post-op, which I'm going to talk about in another video. And I'll talk about the post-op and what you have to do when you give it to them, when you give them that all that information. So and that's pretty much it. um, but but yeah.